Ladies and gentlemen, welcome to our presentation on drug exposure prediction in renal impaired patients based on an IMSM approach. First of all, chronic kidney disease, CKD, is well known to impact drug clearance by lowering renal clearance of the drugs, but also hepatic and non-metabolic pathway by modification of unbound fraction, bioavailability, and lowering cytochrome enzymatic activity, for example. The objective of the study was to build a single model based on a simple in vivo mechanistic static model and IMSM approach to predict drug exposure variation in CKD patients for the drug, mostly eliminated by non-renal clearance. The metric used was the ratio of area under the concentration time curve between renal impaired patients and healthy subjects based on the PubMed research databases. The remaining cytochrome activity was explained by the FR0 variable, which stands for the remaining activity of cytochrome when GFR, the glomerular filtration rate, is theoretically equal to 0. Another variable was added, it was alpha, which is the GFR value for which FR is equal to FR0 plus 0.5, that multiply 1 minus FR0. The predicted AUC ratio of our model were considered as acceptable if they stood in the 50 to 200% interval of predicted unobserved AUC ratio. We had a total of 51 reported AUC ratio available from our literature datasets. FR0 and alpha for impaired renal patients are here reported. For CIP182, it's about 57% of unhealthy patient activity and rises to 100% of activity in case of DSNF, which means that there is no impact of chronic kidney disease on 2C9 activity, enzymatic activity. The visual predictive check is also here available, and all our predicted ratio are in the acceptable interval for range of imprecision. The BS of our model was minus 0.011, and the imprecision was 0.25. We built here an evaluated model for predicting drug exposure modification in CKD for drugs mainly eliminated by non-renal clearance. It is not possible to use it here in real life because there is no external validation, but we hope that it will be made in the future, probably in the next year. Thank you for your attention.